welcome all of you to today's special episode of Positive Barta, Bikash Talks. Today we are going to talk about a mental health condition that is often misunderstood, feared, and stigmatized in the society, schizophrenia. Join us today with our special guest, Professor Dr. Abhay Chillania, who is from Shantiniketan Medical College, Psychiatry Department. Welcome, sir.
Welcome, Namaste.
Sir, can you briefly say something about yourself to our viewers?
Myself, Dr. Abhay Challani. I have done MD Psychiatry from Grand Medical College, Mumbai. Currently working here as a professor.
Okay. Nice to know about you, sir.
Thank you.
Sir, my first question to you, what is schizophrenia and who is affected by it? Schizophrenia কি এবং এটি কাদের হয়?
Schizophrenia is a major mental condition in which the person's thinking, emotions, actions are disturbed. Sometimes it was previously called split personality. It's not split personality, only these three conditions are affected, they are deranged. Generally 1% of the population on an average suffers from schizophrenia, but in some areas it varies. In 2 to 3% may suffer.
Okay. Sir, what are the most common symptom of this disease?
The symptoms, there are mainly of two types: positive symptoms and negative symptoms. Positive symptoms are easy to diagnose because they are very obvious. Patient starts weird behaving, he starts suspecting everything, he fearful to everyone, he feels that someone is against him or her, or trying to harm him or her, or persecute her. And other are the negative symptoms, in which the person gradually becomes asocial, he stops interest in all the things, he can't enjoy the things, and his expressions are he becomes expressionless.
What are the most common symptom of schizophrenia?
This person start talking himself,
Okay.
he without any reason laughs, wanders purposelessly. In some patients they stop taking care of himself, self care is almost none, and without any inclination or any aim, he wanders here and there and nuisance, creating nuisance in the society, in the family. Very difficult to manage in that process. These are the symptoms.
Okay. Sir, my next question to you, what are the main causes or triggers behind schizophrenia? এই রোগের পিছনে প্রধান কারণ বা ট্রিগারগুলো কি কি হতে পারে?
Mostly in many of the cases there is no specific cause, but genetic is the most important. In 60-70% of patients some genetic history is there. His first degree, second degree relatives may suffer from schizophrenia, that's why he develops the symptoms. And stress is the important factor. Every person has stress tolerance capability. If that stress increases or his capability is low, in any case may develop schizophrenia. The genetically susceptible persons have low susceptibility, and even with the minimal stress that may provoke as a triggering factor, and he start developing symptoms.
Okay. Is schizophrenia hereditary or genetic?
It's genetic. There are if one father is having schizophrenia, then chances of developing schizophrenia in his offspring is 6-7%. If both the parents are having schizophrenia, then it may increase up to the 40% of chances of developing schizophrenia. So genetically is important factor, but in many cases we can't stress any genetic coordination. Stress, if within the its capabilities, he can accommodate it, but if the stress increases beyond it, it may manifest as a psychosis or schizophrenia.
Okay. What is schizophrenia? Uh, how actually how the people can understand that he is affected with schizophrenia, or are there any specific tests for it?
No, there is no specific test for it. It's
Okay.
mainly of the clinical diagnosis.
Hmm.
If any person suddenly develops change in his behavior without any reason, and that is continuing for 6 months, then we diagnose it as schizophrenia.
Sir, what are the treatment options or therapies available for schizophrenia?
Main therapy is the pharmacotherapy.
Hmm.
Newer and newer drugs are coming,
Okay.
but the most important thing to treat schizophrenia is early diagnosis. So the awareness in general public is very important. As soon as they notice the symptoms of schizophrenia, they should immediately consult their psychiatrist and start treatment. As the duration of untreated illness increases,
Hmm.
then the remission
Severity.
or chances of prognosis becomes worse. So it's my humble request to general people, keep a watch on your surrounding. If you notice anyone sudden change in behavior, is laughing without reason,
Hmm.
is wondering, he is suspicious of all the things, and his personality has been changed, so one should immediately consult a psychiatrist and seek the treatment, because as early as the treatment is started, the prognosis is very good, and in Indians the social support is good, so the complete remission or complete control is there.
Sir, how important is psychological support along with medication for schizophrenia?
There is very much important of psychological support, because patient itself can't understand the symptoms
Hmm.
and it totally rely on the support. If the in India the good prognosis only because of the good social support, so one must understand the condition and should not judge it as he is doing purposefully, है ना, or he is doing deliberately. One should suspect the diagnosis schizophrenia, consult a psychiatrist, and social service should start as early as possible.
Sir, how can families and social support, as you have said, what are the most common misconception about schizophrenia is there?
Most common misconceptions, people think that he is doing deliberately,
Hmm.
or he is some hidden motive behind his,
Okay.
or he is uh, more of the criminal nature,
Hmm.
that's why he is behaving like this. They can't understand it's because of the illness that can be treated.
Okay. Sir, what is the important to talk openly about schizophrenia?
It's very important, because if we talk openly, then only the compliance is there. Patient start taking medicine
Hmm.
regularly,
Hmm.
he continue it, and with continue medications is the most important factor. to treat the schizophrenia. So it's very important.
Sir, in our earlier discussion, as you have said, the schizophrenia and the split personality both are same.
No, both are not safe.
Okay.
Split personality is very vague term. Previously there were no study, so they consider it as split personality, but it's disorder of the thinking process, cognition, action. That is the different.
ওকে স্যার, থ্যাংক ইউ ফর বিং উইথ আস। আপনারা শুনলেন, আজকে ডাক্তারবাবুর সঙ্গে আমরা কথা বললাম এমন একটি নীরব রোগের বিষয়ে, যেটা অনেক সময় আমরা ভেবে থাকি যে যেই ব্যক্তি এই রোগে আক্রান্ত তিনি হয়তো ইচ্ছা করে স্পেশাল অ্যাটেনশন পাওয়ার জন্য হয়তো করছেন, কিন্তু সেটা নয়। আমাদের প্রত্যেকেরই দায়িত্ব কর্তব্যের মধ্যেই পড়ে যে তাকে তার কোনো তিনি একটি মানসিক সমস্যার শিকার হয়েছে সেই বিষয়টি নিয়ে তাকে অবগত করা, অবশ্যই চিকিৎসকের পরামর্শ নিতে তাকে বারবার করে উৎসাহিত করা। সকলে ভালো থাকবেন এবং সিজোফ্রেনিয়া রোগটি সম্পর্কে আজ আমরা শুনলাম, জানলাম এবং আপনাদের সঙ্গে সেটি শেয়ার করলাম। সকলে সুস্থ থাকুন, ভালো থাকুন, পজিটিভিটির সঙ্গে থাকুন। থিঙ্ক পজিটিভ, বি পজিটিভ, পজিটিভ বার্তা। নমস্কার।